Great.
Good afternoon and welcome to a spectacular Saturday at the Common Ground Country Fair. This is the MOFGA Public Policy Teach-In at the Spotlight tent, and we're going to shine a spotlight today on activism against toxics. I'm Sharon Tisher. I'll be moderating. We have 5 speakers. We're going to allow time for questions after each speaker, so you don't have to stay till the very end to ask your questions. So I've been working with the great folks at MOFGA for 16 years now on toxics issues. And I'm really happy to say that people are finally getting it. And I don't just mean you, because I know you all get it, and I get it. But generally people are getting it, and most people are now getting it. Now let me just give you a Maine example and a national example. In Maine, just this month, the Maine Medical Association, which is a very distinguished organization but not known for its radical position on environmental issues, the Maine Medical Association, the association that represents all doctors in the state of Maine, unanimously, thanks to Lonnie Graham, who made the proposal, unanimously passed a proposition to support chemicals policy reform in Congress. And that's a major step forward, and that's an example of how much people are getting it. Now the other example, which I just learned about a couple of weeks ago and really impressed me, is that there was a national poll done by a distinguished polling group of 825 voters in 75 swing congressional districts. And I think if you go to the website of the Environmental Health Strategy Center, you can probably get some information about this poll. But what really impressed me, the questions were all focused on the level of people's concern about toxic chemicals and toxic chemicals' impact on children and children's health and people's health generally. And as you might expect, 94% of Democrats rated this as a very important issue. But 82% of independents rated it as a very important issue, and 75% of Republicans rated it as a very important issue. 76% of people who describe themselves as conservatives rated it as an important issue. So that's a major accomplishment that has really happened. If you ask someone about 5 years ago about the impact of toxics, particularly the impact of toxics in consumer products, they would probably look at you with a blank expression. But things have really advanced, and they've advanced very well in Maine on this issue. But I'm not counseling complacency or overconfidence. There's a big step between concern that we're seeing here and action, and that's why we're talking to 5 different people in Maine who are activists on various issues of toxics, about what they're doing and how you can help. And speaking of how you can help, there are two pieces of paper that are being passed out that we encourage you to look at and consider. One is a postcard that should be signed and will be sent to the candidates for governor. Is that right? Don't divide it up, and we'll take care of sending it. Just sign it and pass it back to one of the several people who are passing these out. And the other is an application to be on the pesticide notification registry in Maine. You don't have to be a Maine resident, legal resident. If you just have property in Maine, you can put yourself on this. And again, you don't need to do all the complicated computer entry. If you just fill it out, we will enter it on the database for you. So you will get notice of any pesticide applications of certain varieties in your immediate neighborhood. So who we have to speak today, in this order, is Mike Belliveau, Executive Director of the Environmental Health Strategy Center and founder of the Alliance for Clean and Healthy Maine. Nancy Ross, Associate Professor of Environmental Policy at Unity College and a current member of MOFGA's Public Policy Committee. past Executive Director of MOFGA. Paul Tukey, author, organic lawn care specialist, producer of the film A Chemical Reaction, which will incidentally be shown at 5 o'clock today at the exhibition hall. I highly recommend it. And lastly, Laura Stevens, organizer for the Toxics Action Center, and Heather Spalding, Associate Director of Maine Organic Farmers and Gardeners Association. So I'll start with Mike Belliveau, and again, he's going to have about 10 minutes to speak, and then I'm going to cut him off, and we'll give about 7 minutes for questions from you.
Good afternoon. Breast cancer, prostate cancer, ovarian cancer, learning disabilities, obesity, diabetes, metabolic syndrome. What do all these diseases and health conditions have in common? They're all on the rise in the U.S. population in epidemic proportion. There's actually been a slight decline in breast cancer, but historically, epidemic increases in chronic disease and disability in human population. What else do all those diseases and adverse health conditions have in common? Every one of those that I mentioned has been linked to chemical exposure, to hormone disrupting chemicals, specifically to a chemical called bisphenol A, BPA. It's not the only chemical to be concerned about, but there's a campaign underway right now to implement and enforce Maine's landmark 2008 law, the Kid Safe Products Act. BPA has been proposed as the first priority chemical targeted for action under this state law, which is the first chemical policy enacted at the state level in the United States. So what is it about BPA? It used to be that the main source of exposure was plastic baby bottles. This bottle now, in fact, is BPA free. It's labeled as such. 3 years ago, you would have had a hard time finding a BPA free bottle. It was also in the sports drinking water bottles, the reusable plastic water bottles. Those have been replaced by various safe alternatives, such as stainless steel. This used to be the major source, polycarbonate plastic and reusable containers. But moms got organized, they got angry, they worked with public health scientists, they worked with advocates, and they drove the toxic BPA products out of the marketplace, almost entirely. There's still some you can find at the dollar store, which is a case of an environmental injustice, but that source of exposure is largely gone. So where is the BPA coming from? Out of all the people in this room, 19 of every 20 people in this room have measurable levels of BPA in their body. That's been documented by the federal CDC. The major source of exposure now is canned food, including, yes, Muir Glen organic tomatoes, the epoxy resin lining in virtually every food can and every beverage can sold leaches out BPA into the food. In a recent survey of canned food, they found on average about 50 to 60 parts per billion of BPA in the food itself. This is a chemical that acts like estrogen. In fact, when the chemical industry first cooked it up, it was considered as a hormone replacement chemical. It is in our food supply. You can find a few alternatives out there. Eden Foods, canned beans, labeled BPA-free lining. They're one of the few alternatives that are out there now. So you have to look at the linings. So all of us are exposed. The critical concern is exposure during the critical windows of vulnerability when our body is developing. So the developing fetus, the baby, the toddler, our young people going through puberty, older people, when we're going through sensitive changes in our development, all of those changes are mediated by hormones and hormone receptors. That's when hormone disrupting chemicals like BPA wreak their havoc. A major concern for exposure today, and there's a campaign underway in Maine to correct this, is exposure to babies in canned infant formula. Here's liquid canned infant formula, average of 13 parts per billion of BPA in the formula, in the food. Also, the classic glass baby food jars that we all fed our babies from, the BPA is in the epoxy resin lining of the jar lids. So the glass is a good, safe material, but the metal lids leach BPA, so that a recent Health Canada survey found that 85% of the baby food jars, you could measure BPA in the food at an average of 1 part per billion of this hormone disrupting chemical. Now, low part per billion, that sounds pretty innocuous, maybe not a concern. These chemicals, like natural hormones in our body, act at exquisitely small doses to interfere, activate, or shut down hormone receptors. The federal National Toxicology Program out of the U.S. Department of Health and Human Services looked at the more than 700 studies done by independent scientists on the hazards of BPA, and they looked at current levels of exposure, and they formally expressed concern that at current levels of human exposure, if you're a baby at the high end of that range, you're receiving more BPA from these products than the same amount that's been shown to cause harm in these laboratory animals. So what that means is not only is there no margin of safety, zero, you're actually being exposed at levels that have been shown to cause harm, permanent developmental damage in lab animals. Well, you say that's just rats, just mice, who cares about those? We should care because their biology is largely the same as ours. And now the human evidence is coming in. A recent study of male workers in China found serious sexual dysfunction associated with BPA exposure. A general population study of humans found that at higher levels of BPA in our bloodstream, there were seriously elevated risks of diabetes and heart disease. So the human evidence is coming in. Why is this pandemic exposure in our food supply happening? It doesn't need to happen. There are safer alternatives. Here's canned infant formula in a safe plastic. This is the same plastic that 1 gallon milk jugs is in, polyethylene. It's on the market now. It's a safer alternative. Of course, breastfeeding is best. That's certainly a safer alternative. Fresh food instead of canned food is certainly a safer alternative. But now there's also BPA-free baby food on the market. It's safe plastic. This is in the same plastic that yogurt is packaged in, polypropylene. So these alternatives are on the market. Why aren't they required? That's the issue before the Maine Board of Environmental Protection today. And we need you to weigh in and let that agency know, and let the Maine legislature know, that we need this Kid Safe Products Act to have meaning. We need to phase out BPA in infant food, infant formula cans, baby food jars, and toddler food. And we can make that happen. On October 7th, the board's meeting to consider strengthening their proposal. They'll adopt it later this fall. There'll be another public comment period. And then the final action, once adopted, has to go to the legislature for final up or down approval in January. So what I want you to do is go to the preventharm.org website and sign up for the action alerts so that we can get your voice heard. And why does that matter? Because guess who makes BPA? Dow Chemical, Bayer Chemical, ExxonMobil Chemical. The chemical industry is testifying and lobbying in Augusta and all over the country against any restrictions on BPA. Also, the National Can Institute, the North American Metal Packaging Alliance, the industry that does not want to retool. They invested in a 50-year-old technology, epoxy resin linings. They don't want to retool with the safer alternatives. So they'd rather put their profits ahead of the health of our family. And unless our voice, our collective voice is heard, we won't get what we need and deserve, which is a safe and healthy food supply and safer chemicals and healthy families. So I really urge you to get involved. Also sign the postcard that's going around. We're sending a message to all the candidates for governor that they need to defend the Kid Safe Products Act, that it needs to be implemented and enforced. One study that was done at Maine found that the state of Maine could save $400 million a year if we prevented environmentally attributable children's diseases. So we may have a couple minutes for Q&A or no? Yes. So I'll stop. If there's any comments or questions, I'd be happy to entertain those. Come to our booth in the Social and Political Action tent, preventharm.org. Thank you. BPA lining, how long has it been in our cans? I think the technology is about 50 years old. And I think, I'd have to look at the history of canned food, but I think the use really exploded in the last 30 years. And it's also a justice issue. Poor people disproportionately are reliant on canned food. They should not have to be exposed to hormone-disrupting chemicals. We need safer alternatives. Yes?
Talked about BPA. Can you talk a little bit more about a larger strategy?
Yes. Yeah, BPA is the tip of the iceberg. When the federal governing law was passed in 1976, it grandfathered in 62,000 chemicals in commerce, in everyday use and everyday products. No mandatory health and safety testing, and possible burdens on the EPA to actually restrict chemicals. And in 34 years, it's the only environmental law that's never been updated. In 34 years, they've ordered mandatory testing of the chemical industry for only 200 of those chemicals, and they've restricted only some uses of only 5 of those chemicals. So our federal chemical safety system is badly broken. There is legislation introduced in Congress, the Toxic Chemical Safety Act. We're asking our congressional delegation to endorse that legislation. There's a national campaign that we're part of, Safer Chemicals, Healthy Families. Maine is a national leader. We need to do more. We need to defend our gains. We can't go it alone. We need federal reform as well. And we need to fix the whole system. Thanks. Yes?
BPA exposure from cash register receipts?
Yes, thank you. A recent study showed that we can't explain all the sources of BPA exposure from food can linings alone. That the amount in our body is maybe 5 to 8 times more than what can be accounted for from known exposures. One newly understood source of exposure is thermal receipt paper, cash register receipts. A number of the receipt papers that use heat to impart the numbers in printing on the receipt paper are lined or coated, embedded with up to 1% BPA. And it comes off on your hands when you handle the receipts. So if you're a cashier, you're facing serious occupational exposure day after day. You look around the grocery store, you got kids chewing on them, you got people kind of playing with them. They're in our wallets, contaminating our money, and it's on our hands, people eat. So it's probably another significant source of exposure. One of the American companies has switched to a BPA-free paper. About 60% of the cash receipt paper is BPA containing. You can tell if it's this thermal paper, if you rub a coin on it, it turns kind of black or blue, or if you heat it up, it turns dark. I've started saying, no thanks, I don't want my receipt. That's another source that needs to be driven out. Thank you. Yes?
If you use alcohol-based hand sanitizer in drives, will make the BPA
It does. Should I say that? Jody mentioned that if you use alcohol-based skin sanitizer, she believes it drives the BPA in your hands into your skin, dermal exposure. So that could be a source of exposure. The main law, the question was, will the Board of Environmental Protection take into account receipt paper? Probably not at this stage. The law is a consumer products law, so any product that can come into the home that could expose a developing fetus and a pregnant woman or a young child is fair game under that law. we may need to go back and try to expand the law to include other sources like receipt paper. Yep. Anything else? Anybody?
Do you have a source for the reference for that receipt paper information?
Yes. There was a recent national report. The question was a source for more information about the receipt paper. The Environmental Working Group, EWG.org, has a report that was published this summer that profiles the BPA receipt paper problem. It includes a number of web references and links, so I go to that website to get that report. You can also come to preventharm.org, our website, and we can link you to a number of resources and also the ability to get on the action alert list for the Board of Environmental Protection. There'll be another. There was a public hearing in August. There'll be another public comment period later this fall, and then we'll have to prevail in the legislature as well. And if we get the worst of worst outcomes in the gubernatorial election, we may need to override a veto as well. We may need a 2/3 vote of the Maine legislature to put this rule into effect. So we have our work cut out for us, and the chemical industry has prioritized Maine as a place that they need to stop further progress. So we need your help. Anything else? All right. Thank you so much.
Our next speaker is MOFGA's very own former Executive Director and now Professor at Unity College in Environmental Policy, and Nancy has done some very creative work in engaging the Unity College students on toxics issues, and she's going to tell you about that.
Thank you, Sharon. Is anybody out there a college student? Whoa, a college teacher? Hey, solidarity. So, I've been working for 10 years with Unity College students, and every spring I teach a class in advocacy. This past spring, I wanted to bring together my class work with some of the nonprofit advocacy work I do, and so the topic for the advocacy class was toxics reform. And what we do every year is plan and actually carry out a campaign on campus or off. So there are several steps to that campaign. I'll just go over them briefly and then I'll take you through how we did each one of them. The first step is the planning and figuring out what the need is. The second step is doing research and getting your hands dirty and finding out the initial questions that you need to know. The third step is designing messages and programs that you think might address the problems using the research. The fourth step is testing. Usually do that with focus groups and the affected population. The fifth step is implementation. And the last step, maybe that college teacher out there can tell me, is evaluation, figuring out whether what you did actually worked and how well. So for the first step, which is, anybody remember? I can't help it, I'm such a teacher. The first step is the planning and the needs assessment. We brought in a community partner from the Alliance for Clean and Healthy Maine, and the students worked with the partner to identify what the key issues were, and based on those issues define the goals for our campaign. And the goals that the class came up with were, one, to make Unity College students more aware of toxics in food packaging. We stuck to the issue of food packaging. Two, to promote the use of more local foods for Unity College students. 3, to offer Unity College students alternatives to toxic food packaging and global industrial food. And 4, to ask and get students to support toxics reform nationally and in Maine. So the second step, the research. We looked, what are the campus demographics? What foods are students using? We looked primarily at snacks. We have a pretty good cafeteria. We have a pretty good dining service program. But we surely don't control snack. We looked at what's in the vending machines. Then we did the research to look at some of the impacts of the food packaging. And I don't need to talk about BPA because you've heard about it from Mike. We did find out that BPA is not only in many of the cans, but that Campbell's Cup of Soup, for example, which is a big student snack, has BPA in it, and when it's heated up in the microwave, it's even more likely to leach into the soup. We also found out that the containers that students are using to heat up everything from the water to their ramen noodles to their leftover food, a lot of it's made of polycarbonate plastic that has BPA. We also found out that frozen pizza and microwave popcorn was a big snack, and microwave popcorn has another hormone like chemical, endocrine disrupting chemical, perfluorinated chemical called PFOA. And then we started looking into alternatives, and the students came up with ways to heat water that, and this is much more difficult than it sounds, that don't involve BPA. Because if you look at the kettles that you can buy, so many of them, at least in the top, have BPA in them. We looked at local food alternatives to the snacks that students were eating. We looked at the idea of putting common microwaves in each kitchen, because right now students have their own microwave, not very environmentally sound, you have all those microwaves. Anyhow, we looked at what was in the vending machines, etc., etc. And then we designed some messages to get across to students, and we designed ideas. Then the next stage was testing. We held focus groups to test our hypotheses and to look at social norms, to look at who opinion leaders were. We had our ideas, but we learned a lot of interesting things when we held these focus groups. Students don't pay any attention to emails. That was going to be one of our ways to reach people. Students, this was a big shocker. Where do you get information? What's a respected source that you would listen to? Classes and faculty. You could have knocked me over. They also said that the resident advisors in the dorms were opinion leaders and that they would listen to programs put on by them. They told us good spots to put up flyers, they critiqued our messages, and so we developed a plan to meet our goals that included a call to action for toxics reform. I wish I could show you some of the slides of the things we came up with. We found a way to make popcorn in the microwave without any toxics. It's a clay pot manufactured, not in Maine, but in the United States. We found a local source for popcorn, locally grown right here in Unity, Maine. We were able to find kettles that could heat up water that didn't have BPA in them, et cetera, et cetera. We designed, we tested all this stuff. Would they eat that popcorn? Well, if it had the right seasonings on it, we developed the seasonings, blah, 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 blah. And then we had our posters and stickers and brochures, and we, on Earth Day of last spring, we had a big popcorn tasting, learn about toxics show, and we got hundreds of signatures to Maine's 2 senators saying we need toxics reform. So this is like a combination of let's get local food, let's get poisons out of kids' snacks, and let's do something, because you can't shop your way out of this problem. Let's do something to change the system, both at the federal level and the state level. And Mike mentioned the wonderful law we have, but it excludes all food packaging that isn't meant for infants. And excuse me, but those young women at Unity College and all around the country are going to be the mothers of the next generation, and all the studies show that the levels of these hormone disruptors in young women very much relates to the burden that their children are born with. So we did the Earth Day events, we set up a program, I'm almost done, to implement the new regime in the dorms, and the students went out to teachers of the class for first-year students that every first-year student at Unity College has to take, and made arrangements to make presentations in all those classes, plus participate in the sustainability fair about options to toxics on campus and toxics reform.
Are you selling bottled water at Unity College?
No, we are not. As a matter of fact,
Would you repeat the question?
are we selling bottled water at Unity College? No, we have banned bottled water. We have tap water at every event, and every entering student and new staff member gets, well, I don't have one with me. Do you, honey, have a Unity College non-BPA water container? Yeah. So we were already there before we went to the no BPA, no PFOA. Other questions?
So, did you evaluate your program?
Yeah, we did. We've got 3 pages of evaluation plans, and some of it we've already done, so we were able to evaluate the Earth Day presentation. We were able to evaluate our over the summer work and preparation, but we haven't yet evaluated the work in the classes and the legislative reform work that we're doing right now, although we know how we're doing it. And I am not kidding. I got emails from students in that, the class is over in April, right, the end of April. I got emails all summer from students saying, oh, can you resend me the evaluation plan? What was I supposed to be doing?
Did you post the PowerPoint presentation that you had on the Unity College website so other colleges could model the program out?
I haven't done that.
Repeat the question.
Okay. Have I posted the PowerPoint describing this class on the Unity College website? I haven't done that. Maybe it might be easier for you to post it on the Alliance website.
Other colleges.
Yeah.
That's very important. My granddaughter goes to Boston College. They need to be upgraded.
Yeah, one of my goals was to do this at Unity and then find a way to outsource it and
That's
do
very
it.
important. Vortex and Scotch Guard and
Teflon pans. Yeah, that's the same.
repeat the question.
Okay. What about Gore-Tex and Scotch Guard and Teflon pans? That's the same material, perfluorinated chemicals that are in the frozen pizza wrap on the top of it, and the microwave popcorn packaging. Although, not many people are getting exposure through eating it, but and even the Teflon pans, you have to really misuse it. But it's, what happens to all these materials after we're done using them? They go, a lot of them are burned, they get into landfills, it leaches into our water, so there's a lot, they found PFOAs in polar bears. They're getting into the air that we breathe in at falls on us. Yes?
How can I find more information about the alternative ways of making
Okay.
Question.
Alternative ways of making microwave popcorn. Well, you know, there is the way, and I tried to mention this to students, you know, you get an iron skillet, you put they weren't interested. They are interested in this Papa Pot, and if you Google Papa Pot, you can buy it on Amazon for $41. I know, it sounds like a lot, but it's going to last you forever. We've done it for all our freshman doors, and it really tastes great. Papa Pot.
There's an aluminum version and it's steel.
Pardon?
There's an aluminum version and it's steel.
No, it's clay. It's clay.
You can't put metal on.
It's clay. Other questions?
So our next speaker is called Tukey, who is an organic lawn care specialist, and recently produced a fabulous film called A Chemical Reaction, a story of a true green revolution. And this film, and he's going to talk about the revolution, the film is going to be shown today in the exhibition hall at 5 p.m. Paul.
I seem to be a little taller than the first two presenters. Okay, how's everybody doing? I had this t-shirt made just in time for the Common Ground Fair. There you go, if you can read it. And I highly recommend the strawberry puff pastries that I just spilled all over it, right down the road. My name is Paul Tukey, and I like to ask everybody at the beginning of every talk that I ever give all over the country, have you ever been to Bradford, Maine? If you were there at 10 o'clock, you heard the same question. Anybody? Because you can't get there from here, can you? You were lost, weren't you? No, you weren't lost. He knew what he was talking about. I grew up on a dairy farm in Bradford, Maine, where we grew all of our own food. And my grandmother's favorite time of year was started about the third week in April, end of April, early May, is when the dandelions started to pop out. She was absolutely gleeful. She dug up all the dandelions on her lawn. She got what she called a good mess of greens. And then she would race through the neighborhood, down Reeves Road, out onto the main road in Bradford, asking the neighbors if she could dig up their dandelions. And then she would can and freeze all the dandelions that she couldn't force feed into me. She used to say, they're good for what ails you. So what I ask people all over the United States and Canada is, how did we screw it up so badly that we went from a time when most people thought dandelions were good food to a time when most people think dandelions are weeds, and they're willing to put down substances on their lawn that are known, that are admitted toxins. Every single weed and feed package, weed killer package that is sold anywhere in the country either says caution, warning, or danger. Keep out of the reach of children. They admit that the stuff is poison right on the package. But I've always asked people a real pretty simple question. How can you keep it out of reach of children if you bring it home and put it on your lawn? Now, there was a doctor in Canada, because we're here to talk about toxics action and how to take action. So back in 1985, when I was mowing lawns part-time, just before I started mowing lawns full-time, in 1985, this woman from the town of Hudson, Quebec, she was a dermatologist, she had had a patient come into her office who was extremely toxic. She had lost most of her hair, her fingernails, her toenails. In all of the batteries of tests that the hospitals ran, they couldn't figure out what was wrong with this patient. A lot of people told her that she was just a hypochondriac, that she'd done this to herself through nerves. And this one doctor from Hudson, Quebec, found out through trial and error and lots of blood tests that what was causing that woman's toxic reaction was the weed killer that her husband was putting on the lawn 4 times a year to get rid of the weeds. She started testing other people's blood, other kinds of illnesses and rashes that nobody could explain, and more often than not, she found that the most common chemical in people's bodies had to do with lawn care. Because we don't just get trace amounts per billion, parts per billion on seals of jars, and there's absolutely all the information that we've heard is dead on. But think about when you're putting 20 or 30 or 40 pounds per 2,000 or 3,000 square feet of substance on a lawn that your children are then going to go roll around in. So this woman went to the town of Hudson and said, why are we putting poisons down on the playgrounds? Why are we doing it next to the sidewalks where the paper boys go? Why are we doing it on the Little League fields, the football fields? And everybody looked at this woman like she had 3 heads. Absolutely thought she was wacko. She went to every single town meeting for 6 years faithfully. She would write a letter to the town council in French and English. She would read it to the council, basically saying, why are we doing this? Providing data, providing health evidence, other research that had been done. In 6 years to the day from the day that she first showed up, the town of Hudson, Quebec became the first town in North America to ban lawn and garden pesticides. They're the first town. Of course, the chemical industry laughed at this little town of 5,000 people. Said, you can't ban this stuff. In fact, they kept applying it anyway. They said, you can't stop us. The federal government approves it. The provincial government approves it. Well, the lawsuit first went to district court. They said, no, we don't have jurisdiction on this. It went to the Superior Court, and there was nobody in the world thought that they were going to win this, but they surprised everybody in 1993 by winning at the Superior Court level. But the chemical industries weren't through. They appealed it to the appeals court, and in 2000 it went to the Supreme Court of Canada. Does this little town have the right to ban a substance that's approved for use by the federal government? Was the fundamental question before the court. Well, what do you suppose happened? The little town won 9-0. You can't buy Roundup in Home Depot in Canada anymore. You can't buy Weed and Feed in Home Depot in Canada anymore. 80% of Canada now lives under the auspices of a pesticide ban. They call it cosmetic pesticides. They still let farmers use things. They still let some golf courses use some things. But homeowners, landscapers are not allowed to use pesticides for cosmetic purposes to kill dandelions that someone thinks doesn't look good. So I heard that, and I've been covering this story, and that's what the movie that's playing at 5 o'clock is about. It's about that woman. Because I hear the message so often, what can I do? What can I do? I'm powerless. I'm just one person. Well, she was just one person. But she had a mentor who told her one simple thing. Letters to the editor are free. Letters to the editor are free. Write a letter to the editor, try to get it published. And you know what else? Letters to legislators are free. Letters to state senators, letters to governors. And I can tell you, and I'm sure a lot of the other activists in this room, if suddenly an elected official starts getting 5 letters about one subject, they say, wait a minute. They assume that 50,000 other people out there care about this too. Because people don't like to write letters anymore. People are busy. They don't have time. But we don't have time not to do something about it. So the way that this has happened in Canada and now here in the United States, and Maine is taking the lead on this, the towns of Camden, Castine, Rockport, and Brunswick do not allow pesticides on public property anymore for cosmetic purposes. That's 4 towns. That's 4 towns. I'm aware of 7 or 8 other towns that are considering this kind of legislation. You just need to go to a town councilor, show them the movie, show them the data. The Ontario College of Family Physicians, this is on the safelawns.org website, they assimilated all the studies that indicated how bad these pesticides are for health. Say nothing of the environment. And they assimilated it in a report. So you can download this report, you can take it to your town councilor, you can write these letters to the editors and put these facts out there, and you can make things happen just like they did in Camden and Castine and Rockport. And I believe that they're going to do it in Kennebunk. Kennebunk has a program called Lawns for Lobsters. It's a heritage tradition there. Pulling lobsters out of the sea in Kennebunk. Well, these things kill. How am I doing? Am I running out of time?
You got 2 more.
I got 2 more minutes. Figure out who to talk to. Who are the movers and shakers in your town? In Kennebunk, the lobstermen still have a lot of pull, so they started talking to the lobstermen. The lobstermen realized that these chemicals actually kill lobsters. So it turns out in Kennebunk they care more about their lobsters than they do their kids and their dogs, but that's okay. Whatever works. Whatever works. So the message on this one is you can do it. There's so many things. What did we hear? 62,000? Was that the 62,000 chemicals? And I would submit that probably 99% of those, it's pretty hard to do something about or even to know what they are. Chemicals made that plastic chair that I sat on. Chemicals made that camera over there. They're everywhere. And they're hard to control. But we can control what we do in our own homes. That's the easy part. But you can begin to control what we're allowed to do in public places. We've done it with cigarettes. We've done it with cigarettes. We've taken them out of public places. We've taken them out of restaurants. There's no reason in the world that we can't do this with pesticides. And a lot of people think what their neighbors do on their property shouldn't be their right to even care about. But secondhand pesticides are no different than secondhand smoke. It's no different. If the breeze is blowing in your direction on the day that the Chemlon truck comes to your neighbor's house, you just got a pesticide treatment whether you like it or not. Canada has said no more. Eventually we're going to get to private property here in this country. That's a really big fight. I hope I live long enough to see that, and I will. I know I will. In fact, I believe it'll happen within 5 to 10 years. But what you can do today by writing a letter to the editor and engaging your elected officials in this data and this conversation is you can get it banned on at least the public places, and let's start there. One last point. The state of New York just 2 months ago passed a ban on cosmetic pesticides around all schools and daycare centers statewide. Why do we still allow it here in Maine? And we won't if you guys all speak up. So thank you. And I guess we have a couple minutes for questions.
My question has to do with private property, since you pointed out that Maine is one of 9 states without preemption laws.
Right.
Doesn't that suggest that we ought to be able to get started somewhere, maybe not Camden if they don't feel confident, but somewhere where we can ban pesticide use on private as well as...
Okay. Her question has to do with private property. Can't we get started on taking it away from private property owners? I can tell you just because of our Constitution, that's not an easy thing to do, but you can do it. You got to get a sympathetic legislator to put the bill in place. Now, New Hampshire just put a bill, it just went to the legislature last week. I've been there to testify 3 times. They put a bill in place to ban it on public property, but they're not trying to take it away from homeowners yet. What will end up happening, my prediction is that the products are going to go away as a class, because there's a lot of replacement products in place now. So the products are going to be voluntarily withdrawn by the chemical industry probably before we get a homeowner ban. That's my guess. Right here.
Don't you think that individual towns could, under the home rule provisions,
Yes.
ban use on private property?
Yes. She said, don't I think that towns could, under home rule provision, ban it on private property? Yes, they could. They absolutely could. There's something called state preemption. 41 states that wouldn't be allowed, but it would be allowed in Maine if somebody wants to take on that battle. I can tell you,
It's not a farmer.
as long as it's not a farmer, as long as you're not doing it for economic purposes and you're only doing it for aesthetic purposes, we could fight that fight. And we in Maine, there's nothing to stop us from doing that. But I can tell you that the lobbyists pounce on you like you wouldn't believe if you're going to try. Go ahead.
Thinking in Castine, what I learned, what got me inspired is that they started by walking to individuals, to private property owners, and asking them to vote and sign the form where they promised them to do. That's another solution.
She said that in Castine, they walk door to door and ask people to sign petitions. That's exactly how it's done. That's just as old as time, as old as democracy. And let's use democracy to our favor. That's what the movie this afternoon is about. One more question. No?
Where's the movie?
The movie is at the main building, the exhibition hall, and there are books, the Organic Lawn Care Manual. Bob's got them over there if anybody wants one. So we'll be around this afternoon if anybody wants to ask questions. And hopefully we'll see you tonight. Thank you. Oh my God, I get my shirt.
You got a clean one. Thank you, Paul. That was great. Our next speaker is Laura Stevens, who's an organizer with the Toxics Action Center in Maine.
Thank you, Sharon, and thanks for being out here today. Yeah, my name's Laura Stevens. I'm the community organizer for the state of Maine with Toxics Action Center, and I'm actually shorter than everyone else. There we go. So I'd love to give you a little bit of background on our mission and our history, and then talk about a couple of communities that we're working with right now. And we'll actually talk a little bit more about pesticides and what issues going on here in Maine in a couple seconds. So at Toxics Action Center, we believe that everyone has the right to breathe clean air, drink clean water, and live in a healthy community. So over the last 23 years, we've worked with over 650 communities throughout New England to clean up and prevent pollution. We were born in 1987 out of the momentum created in Woburn, Massachusetts, where has anyone seen A Civil Action? Yeah? John Travolta? No, you should see it. It's a good movie. W.R. Grace dumped toxic chemicals in Woburn that contaminated the groundwater. And it actually got dozens of kids sick with leukemia, and many of them died. And from this, a campaign was launched. And in those days, the evidence linking environmental pollution and toxics and disease like leukemia and cancer and reproductive disorders was not so clearly painted. But Woburn was the first time that we saw this very stark link between these two things. And so the tragedy in Woburn led environmentalists to see that we do need more knowledge and experts, but also we need more political power to change toxics. And so in '87, a group of public health experts and environmentalists got together and created an organization to provide assistance and support to communities similar to Woburn. And so Toxics Action Center was born. We started working in Maine in 1999. And there are two stories, we worked with many communities, but two that I'd like to talk with you about today is Sanford, a waste site, an old toxic waste site in Sanford, Maine, and then pesticides in Camden. Sanford, as you probably know, it's in southern Maine, it's in York County, and they used to be a huge center for textile manufacturing. And unfortunately, as a product of this, there are a lot of toxic waste sites in the area, and one of them was Country Gates Art, or CGA. In the 70s and 80s, they would strip copper off of circuit boards in these huge vats of sulfuric acid. And when they shut down their operation, they left this huge 3-acre, 8-foot pile of toxic waste behind. And the site is located right next to David Bernier and his family's property. And so they had been working for decades to try to get the site cleaned up. Of course, the tests were showing that there were really high levels of copper and heavy metals in the soil, and we know that these toxics they're linked to everything from dizziness to vomiting and liver and kidney problems, and even potential brain damage. So the former owners of the site said, no, we have no intention whatsoever for cleaning this up. The local the town council was afraid of doing anything about it because they just didn't have the money to clean it up. And so for 2 decades, the Bernier family had been writing letters to their legislators, to everyone they could possibly think of, asking for help, with no avail. And then Taryn Hallweaver, one of my coworkers, found out that if the town could foreclose on this property, they could get federal funds to clean up the site. And they found out that the deadline for foreclosing on the property was 3 weeks away, and so we rushed to help them build up a campaign and first raise the profile of this issue in the community. And so we generated, letters to the editor and generated a lot of media attention around this, and then met with city councilors to talk with them about the facts about the health impacts and the legal implications of foreclosure, and also to generate enough public support in the community. And so we successfully got the town council to vote to foreclose on the property. Then Taryn helped, my coworker helped to put the Bernier family and the community of Sanford in touch with Representative Pingree and Senator Snow and Collins, who have put in requests for money to clean up the site. So basically the money isn't there yet, but this was a huge step towards victory in getting the site cleaned up. And after decades of this family spinning its wheels, not knowing what to do. So that's just an example of what we do. I also wanted to share with you what the community of Camden has done on pesticide use. So Toxic Action Center has a long history of working on pesticides, much of it with MOFGA, and just a couple of the victories. We got them to stop spraying pesticides on sidewalks in Portland, and we got the largest pesticide sprayer on the blueberry barrens to stop doing aerial spraying, and then we also did a refuse to use ChemLawn campaign, helped to get ChemLawn to launch an organic lawn care line, and for all of the reasons that Paul has shared with us. So in Camden, two residents, Marcia and Patricia, they wanted to do something about this, and they formed Citizens for Green Camden. And these women were on a mission, and they organized their neighbors, and in a year got the town to stop using pesticides on publicly owned lands. And excited by their success, Marcia and Patricia want to take this a step further and address private lands, like we were just talking about. And so they were in particular concerned about two vulnerable populations, the elderly and children. And so we worked with them to come up with a strategic campaign to address these two vulnerable populations by focusing on prohibiting the use of cosmetic, lawn, herbicides and pesticides on low-income housing and elderly housing as sort of the most strategic way to make this happen. And the reason why low-income housing is important is because so many kids live in these homes and they're subject to the whims of the land property managers for their exposure to pesticides. So we also are continuing to help them to build a group so they get the support of their community, and also to craft a message that will have the most impact in this campaign. What the women of with the community members of Camden want to do is unprecedented, as we just established. We're also hoping to use this momentum to do some more work at the state level, and we're planning a pesticide summit for November, possibly November 20th, that you were all invited to attend. So Sanford and Camden are just two examples of the kinds of work that we do in Maine, and we're constantly looking for new communities to work with. We welcome calls, so whether you have a toxics issue that you want to work on, or you know of one that needs to be addressed in the next town over, just let us know. Our website is toxicsaction.org, and I'll give you my phone number right now. It's 871-1810. Just give us a call and we'll see what we can't do to help out. The 871-1810, or I'll be here afterwards, so you can just find me. Any questions? Yes.
In the Sanford example you talked about, where was the state DEP? It seems like that's part of their role to do that kind of thing. Were they not involved?
Yeah, unfortunately, I think they also didn't have they weren't able to help out with that situation.
That's
Yeah,
interesting
what
because we do pay into a fund for that.
Right, but there are all sorts of stipulations for what kinds of state money can be used for what kinds of toxic waste sites, and it's all very bureaucratic, but it turned out that foreclosing on it and getting the federal money was the best route. Yeah. Yes, in the back.
Is there any regulation looking at very old farmland prior to 2005? Back in the 30s, 40s, and 50s, arsenic was used on asparagus fields and in other places, and then it was being like tallow for 20, 30 years, and they've forgotten about it as a source of high arsenic.
Can you repeat the question?
Yes, the question was about asparagus fields, and they used to spray arsenic over asparagus fields. And we have not worked on that issue, but it's very important, and I would be curious to learn more and see if this is impacting water supplies as well. Yeah.
We had a farm in Concord, Massachusetts, as a number of now I'm a chemist. I really heard that.
Up in the front.
Just a question, Patricia, have come up with a blueprint with what they need individual goals and
Right. So the question was, is there a blueprint for the campaign that Marcia and Patricia did in Camden that other towns could reproduce? And we're working on that right now. But you can also give us a call and we can let you know what they did that worked, and we can help you walk you through it. But yeah. About arsenic also being used in apple orchards. Yeah. Any last questions? Yes.
All the facts are there to eliminate fluoride what are we going to tackle that?
Yeah, that's a big fluoride in our water supply.
Town by town.
town by town.
Organized. It has to be organized, right? And the only way it can be done is on a grassroots level.
What's that?
I think it can only be done on the grassroots level.
On the grassroots level.
People talk, don't do it.
Yes, I agree. I think change needs to come from grassroots level. Okay, thank you very much.
Thank you, Laura. I'm actually teaching Laura. I'm teaching a part of a civil action book next week in my environmental law class, and I've been working with TAC for years, and I never realized that you grew out of that incredible case. It's a great movie. I highly recommend that movie. I also wanted to mention, in response to Paul's speech, that people have probably forgotten that in 1995, coming out of an action, some work by the Alliance, Governor Baldacci signed an executive order which actually banned cosmetic uses of pesticides on state-owned properties. Did you know that? Yeah, good. So that might provide some ammunition for people who are working on the local level. So last but certainly not least is MOFGA's own Heather Spalding, Associate Director, who is going to talk about the incredible work that MOFGA has, and along with others, has been doing on the issue of getting an adequate system of pesticides notification.
Just gonna move this up a little bit. I'm a little bit taller. There we go. Great. Thank you, everybody, so much. I really want to start with just saying thank yous to everybody, Mike and Environmental Health Strategy Center and the Alliance for Clean and Healthy Maine and Unity College and Safe Ones and Toxics Action, we just have an amazing network of really talented, really committed, and really well-organized people all over the state, and working on toxics issues and pesticides in particular. That's one of the things that certainly MOFGA has been focusing on for decades now. And so I really wanted to thank everybody for participating in this teach-in, and Sharon, thank you so much for moderating. Sharon has been the driving force, I would say, behind MOFGA's policy work for many, many years. And so thank you very much, Sharon. And thank you to all of you. I really appreciate everybody coming out today to participate in the fair. We've had a wonderful time so far. Yesterday we had over 16,000 people here, and I'd say today there are probably about 25,000 or more. And who knows, tomorrow's supposed to be another beautiful day. So thank you everybody for participating in this. We have a chance every year to gather and to share our knowledge and our experiences, and to think about how we can solve some of the big challenges we're facing in a really creative way. And thank you for being part of that. I just quickly wanted to summarize what's happening with MOFGA, with the Maine's pesticide spray notification registry. A couple of years ago, we worked on a bill in the legislature that was really focusing on notification for all uses of, or for all pesticide spraying when it was applied with aerial or air carrier technology. And air carrier technology means air blast technology, or sometimes you see those big tractor-mounted devices that will be dragged through orchards or whatever with giant fans, and the spray is directed up into the canopy. So that's just sort of the common term for that technology, is air carrier. And we decided that we really wanted to focus on notification. If we couldn't get effective bans on certain very toxic chemicals like organophosphates, if we couldn't get meaningful buffer zones where no pesticides could be sprayed, if we couldn't implement these kinds of systems, at the very least, we should be letting people know that pesticides are being sprayed near them. Oh, there's a little drip happening. Good thing no one's sitting there. So we decided we were going to work with the legislature to see if, at the very least, we could get notification legislation passed. And we had an amazing success. It was incredible, because what we did in the first year of the legislative session was we passed a law that would require people to notify everybody within a quarter mile if they were using aerial or air carrier technology. And we thought that we're just going to have such a difficult battle, and it was really, really rough, and we worked really hard, and in the end it passed, and we thought, wow, we're really making some headway, this is great. You know, yes, it's a no-brainer. People should have the right to know about chemicals that could potentially drift onto their property. But the legislative session goes for 2 years, and the next year we were right back there trying to defend it and trying to push back against people wanting to repeal the progress that we had made, and we lost some ground. But we're still trying to push forward and go beyond where we were 2 years ago, and our goal is to get a notification system that it would be a comprehensive registry for all outdoor pesticide applications, so that if you want to be notified about any kind of pesticide application that's outdoors being sprayed within a certain distance of your property, all you would have to do is go on register online, and then anybody using these technologies would have to consult the registry and find out who is living in a certain, within a certain distance of the place where they're intending to spray. That's what the Board of Pesticides Control in Maine now is gathering input on. And it's really important for them to hear from all of us that we want to know. It's simply a matter of our right to know what kind of chemicals we're being exposed to. And one of the good things that came out of the legislation last session was that they put a few questions back to the Board of Pesticides Control to research and asked them to start consulting with the public health community. And so there is a public health committee that is advising the Board of Pesticides Control right now. And there's some really very thoughtful and very committed people on this committee, and we feel pretty confident that this has the potential to change the discussion and the awareness, and so that this public health committee can give a very clear message to the Board of Pesticides Control to bring back to the legislature that nobody should be sprayed on without their nobody should be sprayed without their consent, and they should definitely be notified before any spraying happens. So we're working on that very hard. We're working, we're in continual contact with the Board of Pesticides Control, and we're attending meetings with this public health committee that I mentioned. People from Maine CDC are on this, the Poison Control Center. There are members from Physicians for Social Responsibility, members from the Department of Environmental Protection, and others who are people with very solid credentials and concerns about environmental health issues. So we are just trying to monitor the evidence that comes out. I would say every week there's a new study that shows very, very serious human health links to pesticides exposure, and these studies they're not just anecdotal evidence from people saying, oh, I have 5 people dying of cancer in my family and we use insecticide in our house. It's not anecdotal. And these are major studies coming out showing very serious links between Parkinson's disease and cancer and neurological disorders and skin cancer and many reproductive disorders. Studies coming from the National Institute of Health, from the Centers for Disease Control, from Harvard University, from Washington State University, from huge institutions with people who have very, very respectable credentials. And there's a very good blog, there's a very good resource that you can go to find out the most recent studies. An organization based in Washington, D.C. is Beyond Pesticides. It's beyondpesticides.org, and they have a news blog, and they're cataloging all of the recent studies, scientific studies that are linking human health problems from exposure to different pesticides. So what our ultimate goal is here, well, it's not the ultimate goal. Our ultimate goal is that we would like everybody to be managing their lawns and farming and managing pests in their homes with organic practices. But specifically with regards to the notification registry, our goal is to develop a comprehensive registry that applies to everyone using pesticides outdoors and is open, free, and open, very easy access to the public, and has very clearly established notification distances. And so your ability to contact the Board of Pesticides Control, to fill out those forms that we're circulating, to get yourself on the pesticide spray notification registry, all of those are very important things to do and to send a clear message to our rulemaking bodies and our legislators that we deserve the right to know about chemicals that are being applied around us and that we want safer alternatives. So I would be happy to take a few questions if you have any about MOFGA's work on policy and pesticides in particular, or any other questions you may have about the teaching or MOFGA in general. So. All right, well, thank you very much for coming again, and if you have any questions, do you have one, Judy? Yeah, go ahead. Jody, that's great. Yeah, we were supposed to have a talk tomorrow afternoon, and Phil and Alice Shabakoff were going to be talking about toxic exposures and what it's doing to children. And they were unable to make it to the to the fair. They had some personal commitments that came up. But fortunately, we have a really interesting replacement that's going to be 2 seniors from Colby College are going to be talking about the work they've done to promote safe cosmetics, because cosmetics and personal care products in general are definitely another source of exposure to unnecessary toxins. And so Blair Braverman and Michelle Russell are coming to talk about the work they did to research toxics in cosmetics in particular, and to make everybody aware of that on their campus. And they're talking about their organizing experiences, and it's really inspiring to see that next generation coming along and taking initiative and writing letters to editors and putting little videos together and using all of the new technologies that are available to get the word out. So that is tomorrow at 1 in the rail car tent. Thanks for mentioning that, Jody. Okay. Thank you very much, and I hope you have a great time at the fair.